Hello beautiful ladies, welcome to YVEREST and Ask the Expert. This is a series of videos that we are putting together to answer all your serious questions or not so serious questions about sexuality, about self-pleasure, about how to engage with your partners in better ways and how to take care of your genitals in a way that doesn't make it embarrassing and difficult. And today we're going to answer a rather complicated and embarrassing question, that of vaginal discharge, the causes of vaginal discharge, and what can you do when things don't really go to plan. Now, the first thing you need to understand about your vagina is that it is actually a self-cleaning organ. But one thing that is really important to remember is that the pH level in your vaginal canal really has a lot of impact on whether your vagina is healthy or not. Now, the natural pH level of the vagina in the best of cases is around 4.5, which actually means that it's a slightly acidic environment which prevents bacteria growth. Now, of course, there's a lot of, we are in symbiosis with a lot of different other beings on this planet, and of course there are a lot of bacteria in our body. So the most important thing to remember is that a healthy vagina is a vagina that is well balanced, and when your vagina has the right level of acidity, it is able to control the overgrowth of bacteria. Now, sometimes you may find that without having sexual contact, there are still certain types of discharges that happen, and you may not know whether they are STIs, sexual transmitted infections, or just natural imbalances in the body. So today I'm going to talk about the fact that the moment there is an imbalance in your vaginal canal and it becomes a little bit more alkaline than what it should be, it is possible that there will be bacteria growth and that will generate discharge. Now, there are 4 reasons why the pH in the vaginal canal changes. And if we are going to start with unprotected sex. Of course, during the fluid exchange, during unprotected sex, the whole acidity of the vagina increases, or decreases rather, because it is a normal process of the body that allows the whole lubricant that makes sex more pleasurable. It also becomes more alkaline because sperm needs an alkaline environment to actually make it to the egg. So during sex, your vagina naturally changes from an acidic environment to a more alkaline environment. So that's in itself a good thing for the sperm, but if you're not trying to get pregnant, it can create an imbalance. So you may find that you wake up the next day or the day after unprotected sexual contact to find that you have some sort of discharge. Now, you don't need to panic. It doesn't necessarily mean that you are going to need to go to the doctor, because not all discharges are actually STIs. But you do need to be aware that the most common type of discharge that happens when your pH level in the vagina changes is called bacterial vaginosis, which is that pretty nasty smelling, fishy smelling discharge that comes in sometimes greenish. It comes with a lot of itchiness, and it's in general very unpleasant. It is definitely necessary for you to go to a gynecologist and check that this is actually BV, because it could also be yeast infection, and then the treatments are quite different. But the difference really is that yeast infections are not that smelly. Bacterial vaginosis is quite smelly. So you will see also a color change. Yeast infections tend to be white and kind of milky with a lot of bits inside, a bit like bean curd, whereas bacterial vaginosis has more of a green tinge, not very nice. But neither of these are actually sexual transmitted diseases. You still need to go and see a gynecologist to get treatment. However, for yeast infections, you can get over-the-counter medication. I'm not a doctor, so I'm not going to give you any ideas of what that over-the-counter medication is, but your pharmacist can help. Now, the second reason the vaginal flora gets a little bit imbalanced is when you take in antibiotics, because antibiotics kill a lot of things in the body. On top of the bacteria and the viruses that they're supposed to be killing, it also changes the overall alkalinity or acidity level in your body. And for a while your organism and your cells are trying to figure out what's going on with all these chemicals that we've put in the body, things can be a little bit out of whack. It can also impact your contraceptive pills, by the way, so you need to be more careful in the period when you are taking antibiotics. The third reason why sometimes the bacterial flora inside the vagina gets a little bit imbalanced can be if you tend to do what is called douching, which is internal washing of the vagina. There's a lot of different ways that people do it, but in reality you don't really need to do this because the vagina is a self-cleaning organ. So as long as you maintain the balance in the right place, as long as you are careful about certain things, like I said, unprotected sex and stuff like that, there are very few reasons why you need to douche in this area. And last but not least, the fourth reason why the pH levels in your vagina may change is actually menstrual blood. As the menstrual blood passes through the vagina, it can affect the alkalinity and the acidity of the canal, and also it really depends on the kind of tampons that you're using. So if you're using these kind of run-of-the-mill regular internal tampons, because the tampon sits there for quite a long time, this can also affect the acidity levels of your vaginal canal. So be careful what product you use, try to change your tampons more frequently, and that way prevent this imbalance to happen. The other things that you need to remember is that sometimes vaginal discharges can also be caused by emotional imbalances, right? We know that our emotions are actually transferring physical symptoms to the body, that essentially disease is a sign from our body that there's an imbalance at an emotional level. So a lot of these discharges can also be triggered by an emotional factor. For example, if you've had unprotected sex with someone that you maybe don't know so well and you're feeling a little bit guilty about it, that emotion of guilt can actually generate this kind of imbalance at your pH levels in the vagina. So this may actually also trigger some discharge. If that is the case, you can try meditation, you can try hypnosis, you can try maybe a healer that can balance your sex chakra. But these are all different solutions that, if you're interested, we can explore in a different video. Meanwhile, the most important thing to remember when you're trying to protect yourself and make sure that your pH balance is as nature intended it, is really to try to avoid unprotected sex. Of course, if you are in an exclusive relationship in which you have loving, connected, intimate sex with your partner, just remember that sometimes, the acidity level and the alkalinity level in your vaginal fluids and your partner's sperm can be a little bit at odds, but it doesn't mean that it should affect your sex life. So as long as you're not in an exclusive relationship, it is obviously always highly recommended that you use protection, because not only is this protective from pregnancy and sexually transmitted diseases, but it also keeps the balance of your vagina as nature intended it. So stay clean. In terms of what products you need to use, like I said, regular shampoos and shower gels tend to have different degrees of pH levels. So for your intimate area, you can use intimate washes, but obviously only on the outside, because like I said, the inside is something that the body regulates naturally, because our body is actually a homeostatic machine, which means that it naturally comes back to where it should be. So unless there is an actual overgrowth of bacteria that requires medical intervention, it's actually okay not to put too many chemicals in this area, and try to keep things quite simple. Ultimately, if you shower every day, at least once a day, you don't really need to use a lot of chemical products, because your genitals are a very, very sensitive part of your body and you need to be gentle with them. So you can use baby shower gel if you really want to keep things simple, and otherwise just use water and just enjoy having a good time by yourself and with your partner. And of course, don't forget, if you're using toys to experience self-pleasure, you always need to wash your toys, to clean your toys after every use, for obvious reasons. I don't need to explain why, but I just thought I really need to put this in here just in case you thought nothing happened. Especially if the toys that you're using tend to be more for clitoral stimulation. That also needs cleaning, because you don't really want bacteria to kind of overcome your pleasure bud. So I hope you enjoyed this video and you found it useful. And if you have any specific questions about any parts of this or any other medical or hygiene issues regarding your genitals, let us know, and I'll be back with another video very soon. So thank you for listening, and see you very soon.